want to know the difference between menstrual length and the period duration itself. Hi, welcome to Dr. Godisman Health Tips Corner. Today I want to discuss a very important aspect of the female life, of course, the menstrual cycle. Something that is very common in the clinic, something that I want to throw more light on. Calculation of the menstrual length. We want to know the difference between menstrual length and the period duration itself. But let's look at the menstrual length. How to know the length of my menstrual cycle? Of course, I can't have menses. Do you know when your last menstrual period began? Or how long it lasted? If not, it might be time to start paying attention. So tracking your menstrual cycles can help you understand what's normal for you, your time for ovulation, and identify some important changes such as a missed period, unpredictable menstrual bleeding. While some irregularities in the menstrual cycle can not be a problem, but sometimes it can actually signal health challenge. What's menstrual cycle? Of course, menstrual cycle is the monthly series of changes a woman's body goes through in preparation for the possibility of pregnancy. Anytime you see your menses, your body is telling you that it is capable of conception. So there are some processes that undergoes in preparation for any possibility of pregnancy. So each month, one of the ovaries releases an egg, a process called ovulation. Each month, one of the ovaries, of course, a female have two ovaries, one of the ovaries releases an egg. That process is called ovulation. At the same time, hormonal changes prepare the uterus for pregnancy. Uterus is the womb. So hormonal changes at that same time prepares the womb or the uterus for pregnancy. If ovulations take place and the egg is not fertilized, the lining of the uterus sheds through the vagina. This is what they call menstrual period. If ovulations take place and the egg that is being released is not fertilized, that is, the egg does not meet a matured sperm, the lining of the uterus sheds through the vagina. So the shedding of that lining of the uterus is what we call menstrual period. What is normal? The menstrual cycle, which is counted from the first day of one period to the first day of the next period, can never be the same for every woman. So menstrual flow might occur every 21 to 35 days. That is the length of a cycle. 21 days to 35 days. So menstrual flow occur every 21 to 35 days and last 2 to 7 days. So that's what I said, that the menstrual length can be 21 days, it can be up to 35 days. It's still within normal range. So for the first few years after menstruation begins, long cycles are common. That is from your menarche. Menarche is the first menses the girl child sees. So from your menarche, from the first menses that you see, that first few years, your cycle can be longer and become shorter as you are growing old. What I'm saying is that menstrual cycles tend to become shorter and more regular as you age. So your menstrual cycle might be regular, about the same length every month, or somewhat irregular, and your period might be light or heavy, painful or pain-free, long or short, and still be considered normal. Let me take it again. Your menstrual cycle might be regular. What am I saying about regular? About the same length every month, or it can be somewhat irregular, and your period might be light or heavy, painful or pain-free, long or short, and still be considered normal. Alright, how can I track my menstrual cycle? To find out what's normal for you, start keeping a record of your menstrual cycle on a calendar. Begin by tracking your start dates every month for several months in a row to identify the regularity of your periods. If you are concerned about your periods, then also make notes of the following every month. The end dates. How long does your period typically last? Is it longer or shorter than usual? You will know. The flow or the bleeding. But today, let's look at menstrual length. Let's look at how we can track and know the menstrual length. This is my calendar, which you have in your house. Suppose in this month, I saw my menses on the 3rd of a month. Maybe I saw my menses on the 3rd of January. That day that I saw my menses is day 1. I saw the next menses on the 31st of January. So that 31st is the beginning of the next cycle. So what is my menstrual length? My menstrual length for the month of January will be 1, 2, 3, 27, 28. So for the month of January, my menstrual length is 28 days. I have a 28-day cycle. Remember, you track like this for about 3 to 4 months before you establish your menstrual length. Now, see, my flow was on the 3rd and the next flow on the 31st. The myth is that you can be scared. I see menses 2 times in a month. It's normal. Because I can see young girls coming to the clinic complaining of seeing menses 2 times in a month. When once you know the length of your cycle, even if you see menses 2 times in that same month, it is normal. So this particular month, seeing menses on the 3rd of the month, seeing again on the 31st, the menstrual length is 28. Supposing that I track for subsequent months, I still have 28. Right. So if my menses on the next menses is 31st, when would I see the next menses after 31st? What you will do that 31st is day 1. You count 28. Day 28 is the day that you are expecting to have a flu. Alright. So for today, you have known your menstrual length. Go on, track all your menstrual length, maybe from previous months, and try to see whether it is regular. Try to see whether you have the same number of days in between. That is how to know the menstrual length. In our next episode, we are going to look at ovulation, when are you safe, when are you not safe, and all other measures surrounding the menstrual cycle. Alright, for what we have studied so far today, if you have any question, any doubt, anything that you want to clear, please drop it in the comment section. I'm ready to answer any question, or if anything about the reproductive cycle that you want us to discuss in our subsequent episodes, please let me to know. Thank you for staying to the end of this episode. See you in our next episode. I still remain your friend and your doctor, Dr. Godisman. Bye-bye.